the history behind the specialization in genital herpes.
Okay. So I was diagnosed with herpes when I was a teenager by a visual diagnosis, which now the CDC actually says should not be done, that a visual diagnosis should always be backed up by a confirmatory test. And so I had gone to just like a walk-in clinic, and the doctor thought that a lesion that I had was a herpes lesion. And so I, of course, thought my life was over. And I mean, I was 16 years old, and I just thought nobody's ever going to love me. And I ended up um, kind of starting to go through that process. I was taking valacyclovir as suppressive therapy because I knew that it would prevent outbreaks or reduce the risk of outbreaks and transmission. But I, sorry, I lost my train of thought.
Okay.
So I really had to kind of work through that, those issues of self-esteem. And even though I wasn't getting outbreaks, I knew that many people who have herpes don't get outbreaks. And so I went the next 8 years thinking that I had herpes, going to support groups, working on my self-esteem. I eventually got to a point where I had told all of my friends that I had herpes, and then I decided to disclose to a potential partner. I wasn't having sex after that experience. I didn't have sex. I was abstaining from sex until this time where I told this potential partner. And when I disclosed to him, he said, this is making me too happy to not be with you because of something like that. And that was just like a wonderful first experience of a disclosure. And at the time, these tests had come out where you could find out if you had type 1 or type 2. And so I went to just find out if I had type 1 or type 2. And it turned out that both tests came back negative. And
What?
so,
Crazy.
yeah, after all those years of
And then
living as though,
too.
sorry?
And also having to take medication.
Right, and taking medication and all of these things. And so at the time, I was going back to school to become a certified holistic health coach. And I thought to myself, I really want to give back to this community that had been mine for so long and really help people to, get their self-esteem back, because I had to work through these issues. And and so as a coach, I started helping people with herpes to just start eating healthier. And I formed a support group for people with herpes. And then, I think I mentioned earlier that I ended up feeling kind of limited in all the ways that I could help people in their mental health. And that's when I went back to school to become a therapist.
A few times, so it's really enlightening.
With you.
So now let's kind of get into more of looking at herpes and mental health. So in your experience, what effect does a herpes diagnosis have on mental health?
Feel like this isn't something that they thought they were really at risk for, and it's pretty surprising. Or they didn't think they were the type of person that gets herpes, but really herpes doesn't discriminate. I mean, like I said before, most people who have herpes don't even know they have it. And so it's really easy to contract it even in a monogamous relationship from a partner who had no idea that they were infected. And so when people come, they're feeling quite down. They're worried that nobody's ever going to love them. Am I ever going to have sex again? How am I going to tell people? There's a big stigma about herpes. And so people feel a lot of shame. And I think reaction or responses kind of vary between, depressed mood to anxiety. And then sometimes people become very depressed or very anxious. Um, you know, and it's really important to help people kind of reconnect with who they are, and all the other things that they bring to the world, to life, that are so valuable, and to help them recognize. I mean, I've been doing this now, working with people who have herpes for over 20 years, and so I think, I'm in a unique situation where I've been able to see the vast majority of those people go on to live normally again, to live their lives normally, to have sex, to have relationships, to date, to go on to have families and have babies. And so I'm able to sit across from these people who are newly diagnosed and give a very realistic sense of hope.
You also had discussed in the past was, not that it's exactly the same, but a condition like HPV, which can cause cervical dysplasia, abnormal paps. Uh, from the male side of things, we don't have a test for males. Many men are carrying it; they don't know. And then, depending on how often somebody's getting paps, they also might not know that they're carrying this virus either, and there can be this major stigma. Then I guess so for somebody specifically who's really struggling with feelings of shame and worry, in your experience, how do you help these people? How do you help them uh, either, I don't want to say get over these, because I mean, obviously honoring anybody's feelings and reactions towards any type of diagnosis or anything that they're going through, but I guess like coping through these feelings.
What's been lost. There's almost like a sense of innocence and a sense of carefreeness that's often, there's often like a loss, and especially for women, our sexuality is judged more harshly in society. And so just this idea that, I'm dirty or whatever, like I think it's really important to help people kind of say these things out loud and to feel understood. And then, I really try to let them know that hope is possible and that the vast majority of the people that I've worked with have gone on to figure this out. And even though it doesn't feel that this way right now, this is a possibility for you. So I think, like, I like to bookend it, like with one on one side, having a space to kind of like get all the feelings out, and then on the other end to say, hey, there's a really good reason for hope. And then, we go through a process. It takes people different amounts of time to heal from this. Some people are able to kind of bounce back very quickly, and other people, it takes them a few years because, maybe they already had other things going on that had affected their self-esteem, or made them lose faith in romantic relationships, that we may have to work through. um, I often find that the feelings about herpes are sort of, um, you know, usually once we kind of get past the initial pain, there's other stuff underneath that is sort of impacting how a person feels about themselves and about what's happened and about their hope for relationships. And so not only do we work on healing the pain associated with this diagnosis, but also, what kind of relationships do you want to have? And are these the kinds of relationships you've been having? And if not, what can we do about it?
A little bit of a technology glitch with first going live, which will have everything nice and smooth for the finished recording. So we are talking about mental health and herpes, and I guess because kind of like to some of the things that you were saying, some people might get diagnosed with herpes and it's not a big deal to them, and they might have like they might feel comfortable disclosing to partners, and they don't have this same sense of shame and guilt that somebody else might carry that. I mean, and I, having also worked a lot with patients with herpes, having some of them not even tell their husband that they have it, and rejecting sex in times of outbreak. One of the other things that I'm kind of just like a little bit curious about, because when I am working with herpes patients, a big part is looking at both like outbreak prevention, and then when somebody does have an outbreak, and there is such a connection between, as even the literature supports us, stress and herpes. And so I guess maybe talk a little bit about maybe how you help, like what do you see as far as like with your patients, like do you find that like when there's a lot more emotional upheaval that they're having more outbreaks, and how you support them during those times?
Outbreaks. Um, and people will often notice that if they're going through a particularly long period of stress, that um, they're able to make the connection that, I think this is why I'm getting an outbreak or whatever. Um, I the vast majority of my clients end up going on valacyclovir at some point, and I have found personally that um, it it's actually like not doesn't just reduce outbreaks, but it actually helps people's mental health because it gives them some reason to feel, or it gives them a way to feel in control of something that feels um, something so difficult to control, right? Like it's in your body, like it's hard to kind of be like, well, don't outbreak now, you know? um, so, so people often, like when they're taking valacyclovir, which reduces outbreaks and also
Right.
reduces the risk of transmission by almost 50%, it tends to like actually like relieve stress, right? And worry. Um, and there are some people that, prefer to not take valacyclovir. And with those individuals, then we just need to work through like other ways of reducing stress, which we would do anyway with anyone. Whether it's coping tools like exercise or um, you know mindfulness, things like or breathing exercises, or changing something. Often it means having to let go of something in the schedule that you might really wish you could keep.
New York City, because there's this you can't just have your 9 to 5 job. You also have to have like your hobbies. You have to have like your friends. You have like the list can go on. And you had children, and it's like you have how to find that time to let something go, or I think also sometimes society puts a lot of pressure on. I don't know if it's like this. Society put the pressure on us, or we're choosing this pressure, but this specifically women and delegation, and like you can't do it all sometimes, and that sometimes whoever you give that task to, however they do it, is good enough if it helps to free up some space and some time for something that's going to be helping to rebuild you. As your patients, do they talk a lot about transmission toward with partners, and how often is that even really an issue that's coming?
like once you get to the disclosure, well, like but what if I transmit it to a partner, right? And the idea, it's such a scary idea for people. Um, and I think it's really important to work through, well, what if you do? Because I don't like to kind of just like toss that to the side and say, oh, don't worry about it, because I think it's really important to sort of face the possibility that it could happen. And at the same time, again, I've been doing this work for over 20 years, and I don't really see a lot of people or a lot of my patients who report back to me transmitting. And that's not to say that it's not happening or that it can't happen or that some people just haven't told me about it. But the people who stay in touch with me, and I do have people who stay in touch with me because people come back. Either they come back to therapy for new reasons, or that they come back to speak at my group for women with herpes as a guest speaker. Um, they tell me they haven't transmitted. And, those are people that are typically on valacyclovir as suppressive therapy. These are people who have typically had long-term relationships or are in a long-term relationship and have stopped using condoms. So, education, I think being educated about the diagnosis and taking valacyclovir are very helpful for protecting partners. Now, again, many people with herpes don't know they have it. And so, there's always the chance that a transmission's happened and their partner doesn't even know, because usually partners in long-term relationships, by that point, they're pretty relaxed about the fact that their partner is positive, but that doesn't mean that they're getting tested every time they go to the doctor or anything. But people have generally had good experiences with this. I read a study once that showed that people who disclose to their partners are at less risk of transmitting. um, and I think that's probably has something to do with um, being open and honest, being able to know, um, being able to talk to your partner about what's happening with your body, and for there to be like open communication in the relationship. I think that goes a long way. Most of the people who work with me, who initially come for an initial diagnosis, contracted herpes from somebody that did not tell them they had it, whether it's because that person didn't know or whether it's because the person was hiding the information.
When is a good idea, like from a safety perspective, like when is a good time to abstain from sexual activity if you've had an open communication already with your partner? They're going to be a lot more one understanding versus like, oh, they want to have intercourse with me. I don't want to kill the mood by saying, oh, this isn't a good time. I'm just gonna go with it because why else? Like, or avoiding sex altogether. So I think having that open communication. It's funny because when we first decided to have this interview, I wasn't going to really take it in this uh, direction, but now I'm kind of curious. So what I'm not gonna we're not gonna go so much into the medical treatments, whether natural or conventional. But I'm just kind of curious. The majority of the patients that you work with, are they taking acyclovir, valcyclovir, and have you noticed any like difference between those that decide to go that route versus those that go the natural? And we're not going to get so much into the specifics of the natural route, but I'm also curious about with those that might, why, I guess either why they might not choose to do the conventional route, and then if those that choose not to, are they doing it alone or are they working with a practitioner, and if that makes any difference at all?
Almost never seen somebody have side effects from it. So people tolerate it very well. Um, and it tends to make people feel better, just because they feel, like I was saying earlier, they feel better. They feel like they are more in control, and it gives them some confidence in the reduced risk of transmission. Um, I have had some people who've chosen not to take valacyclovir because they just that is their approach to life. They prefer to not take medications if at all possible. Some people don't take Valtrex because they don't like the reminder of taking a daily pill that they have herpes, and so that can have an effect on some people. Um, and a few of those people have tried natural ways to reduce outbreaks, but usually it's stuff that they've found online. And they usually are, yeah, they're doing it by themselves. They're trying to figure it out by themselves. And um, often people feel like I think if they a very common one is taking lysine, even though we don't necessarily have good studies to show that that's effective. Um, that's something that sometimes makes people feel better, though. That makes them feel like, okay, I'm doing something for myself. You know, but I've had people also, they've tried everything they've read online. They did it religiously, and they didn't feel like it made any impact. I haven't actually had anyone I think that has worked with somebody, who might be more knowledgeable about how to like improve, you know, the immune system, or how it might, help somebody manage their outbreak. So I don't really have an experience with, how that might be effective for someone.
On exploring also some other root causes that might be why somebody might be having the outbreaks, because I have worked with some patients that were still having a lot of outbreaks even on a Valtrex. So there's definitely, and definitely obviously just like anything else, like buyer beware. There's some really terrible products out there, and that you needing to really do research if you are deciding to go on it on your own. So I just kind of was like a little bit curious about your experience with that. And then what, like, I guess, like when helping your patients specifically, disclose their diagnosis with their partners. What has been some of the surprises that have occurred with that your patients might not have expected?
I think that that people tend to be very surprised when they find a partner who's accepting, or find out that, I mean, I think rejection certainly happens, and I work with patients to like think that through before, because it can happen. And just because often it doesn't happen doesn't mean that it won't happen, right? Like, we all get rejected. It's part of life, for all kinds of reasons. Um, but I feel like in my experience, more often than not, partners are actually accepting. Um, and, I think, you know, one of the things that I often work with patients on is remembering that just how valuable connection is. Connection and chemistry are really powerful things, and we don't find it with everyone. And so when we find it with somebody, whether it's a casual partner or whether it's somebody we might want to have a long term relationship with, um, we tend to hang on and want to, um, figure things out, like figure out the problems that come up that might prevent us from maintaining that connection. So I think that that's why so many acceptances do happen. And plus, you know, different people have different levels of risk tolerance, and some people are really happy with, the reduction of risk that valacyclovir provides, or that condoms provide. And, life has risks. And, you know, um, I think that, some people will do everything they can to prevent anything bad from happening, and other people are like, I'm living my life, and this is a reasonable risk to me if we take these particular precautions.
Does like timing factor in? Like when would you say is obviously before someone has intercourse with a potential partner, but is there, because I would think also it's not even just whether or not this person wants to continue to see one, but also is this person trustworthy that they're not going to, because we also don't want everyone telling anyone our personal business, and it doesn't even have to be around herpes. I mean, it could be anything from our past that we find private, but that would be important for us to discuss with someone who is going to be our partner, specifically a long-term partner. So I don't know if there's like that magical like third date. Uh,
And interested in casual experiences, and so they might want to have sex with a partner on the first date, or maybe somebody that they've just met, out, at a bar or something like that. And I have watched people who wait for months right before sex, and they don't disclose to their partner until they feel sure that they want to proceed with a relationship. Um, and I have also watched people who have met somebody at a club and wanted to go home with them and disclosed right away because, um, you know, it wasn't about, do I trust this person? It was about, I need to communicate sexual health information. And I've watched people in both of those situations be successful with disclosure. So I don't think there's a magic number. I think it is much more about what's right for you, um, and how do we work on disclosing in a way that feels authentic for you, as opposed to, a lot of people will come to me and say, I read online that I'm not supposed to cry and I'm supposed to be confident and all of these things, and it can be so much pressure. Of course I want you to feel confident when you're disclosing, but like, it's not a requirement. Can be a human being. And I have had clients who've broken down crying during a disclosure that ended up going fine, meaning, well, maybe they didn't feel like they were fine, but, they ended up having an accepting response. And I've had people who've disclosed confidently that didn't get an accepting response. I think that there's just a lot more involved in, um, whether somebody's going to say yes or no. And I think it's so important for people to feel, like they can be themselves, because we want to be ourselves in relationships with other people.
that I can 100% be myself, and who I'm with can 100% be themselves. I won't always like that of that person, and they might not always appreciate that about me. But at the same time, I feel like I can be complete needs. Of course, like obviously that takes like trust and all these other things, but this is definitely part of that. And
Tolerate like emotional expression, right? Like, who can be there for us when we're sad and like not run away, right? And so, um, I think there's something about being able to go into a disclosure with just sort of some awareness that, I deserve compassion.
Would benefit from knowing about whether it's herpes and mental health or some other kind of takeaways that might be helpful.
Most important thing is that, our sexuality is like it's normal, or like being interested in exploring sex with a partner or partners is normal. People contract herpes from doing normal things. And I think, you know, it's really something that I try, because sometimes people come in and they just feel so ashamed, and they feel like, if I didn't do this, if I didn't do that, and it's unfortunate. Some people do contract herpes in a situation that they didn't choose, you know, like a violating experience or something like that. And that's different. But for many of the people that come to me, they contracted herpes in a very normal situation. They didn't do anything that everyone else isn't doing. And I think it's really important to just remember, like, sexual behavior is normal. Of course, you're interested in sex. Of course, you need connection and touch in your life. And, you know, we just, you didn't do anything wrong here. And also, like, of course, I think it's really important to use condoms to protect ourselves when we're in a situation that is maybe non-monogamous or with a new partner and we haven't gotten tested. However, um, we research has shown we're not great at using condoms, and um, it's, so people sometimes will come in and they'll feel bad that they didn't use a condom with a particular partner. And by the way, you can contract herpes. Condoms, so you can contract herpes even if you did use a condom. But sometimes people will feel really bad that they didn't. And I understand, we all want to aim for our ideals. But I think it's really important for people to know, it's not, you didn't do anything that's not normal. Like, lots of people are not using condoms in these situations. We're just like, we're not very good at it. As much as I would love for us to be better at it, um, I don't. I think when people are in this kind of situation, they feel like I'm the only one that's didn't use a condom in a situation where maybe I should have. And I want people to know that's not the case.
Yeah, I mean, it definitely is very common. And of course, also, it's not even just, when we think about condoms, also, it's not just about obviously preventing herpes, but other sexually transmitted infections, pregnancy. But yes, whether it's the heat of the moment, wrong size, all kinds. I know that we have sex education in many schools, but even that, I would say, is probably lacking. And I think that there's still a lot of miss. And I'm not going to say, even though I'm a naturopathic doctor, I wouldn't say I'm even the expert in this area. But exactly as you're saying, is that all the behaviors that one might have done to contract herpes, probably the majority of us have. And it's that unfortunate luck of the draw. And then, of course, as we've talked about before, that some people having each of these behaviors, they do have herpes, and they actually don't even know that they have herpes.
And then, so then when people get this in a long-term relationship, they're like, why haven't I been being tested for herpes? Nobody ever talked about it. And I do wish that doctors at least told their patients, hey, we don't include herpes in this test, and this is why. That I think that would go a long way for just helping people to understand that herpes is a risk. It's out there in the world. I had a conversation with my doctor about it. Lots of people don't know they have it, and people aren't getting tested for it. So, I mean, just that alone, I think would help a lot of people when they do get diagnosed, because I think the more that we hear the word and hear the reality before you end up getting it, it helps.
From their first sexual encounter or their partner that they've been with for multiple decades, and then other patients having multiple partners getting it, and then people that don't get it all and have it. So so I think it's just really important to like really normalize. It doesn't necessarily mean that we need to be like willy nilly engaging in a risky behavior, but just normalizing. This is a lot of people's experience.
And we're social beings, and we catch colds from each other, and we catch the flu from each other, and and we this is it's I think that again, like you said, we want to be protect ourselves in the ways that we can, and the best that we can, but also um this I think that if we were talking about these things more as part of sort of just being a human being and being in the world, it would really help to reduce the stigma.
I've had a wonderful conversation with Melissa King all about mental health and herpes. Her contact and everything is in the description of this video. Her website is myheartdances.com. If you liked the video, please do not forget to like the video. Also, definitely subscribe to the YouTube channel. I have some really exciting interviews coming up in 2 weeks. I'm going to be interviewing Alexis Pace, who is a neurofeedback specialist, and we're going to be discussing women and ADHD. I'm also going to be talking to Dr. Reba Prell, who is a pelvic floor physical therapist, in September, all about postpartum pelvic floor. Again, this is Dr. Branin of Simplicity Health Associates, and we are really looking forward to seeing you next time.